Good morning, good evening, good afternoon, everybody. Wherever you are, this is the International Academy for Clinical Hematology around the globe and across the hematology field. My name is Mohamad Mohty from the Sorbonne University and Saint-Antoine Hospital in Paris, in France. And it is my great pleasure to welcome you all to this new broadcast as part of the ICH for Patient series. And today's webinar is dedicated to a chronic, so-called benign disease, namely ITP, immune thrombocytopenia. But the problem, although being benign, it can have a major burden on patient quality of life. So as you probably know, ITP is an autoimmune bleeding disease caused by immune-mediated platelet destruction and decreased platelet production. ITP is characterized by an isolated thrombocytopenia, usually less than 100,000 per microliter, an increased risk of bleeding, actually. The disease has a complex pathophysiology where an immune tolerance breakdown leads to platelets and megakaryocyte destruction. Treatments include corticosteroids, IV immunoglobulins, rituximab, TPO agonist, thrombopoietin receptor agonist, and at the end of the day, the aim is to increase platelet counts to prevent hemorrhagic symptoms and manifestations, and of course, increase and improve the quality of life of the patient. We also know with all this that ITP patients are going to struggle with fatigue and a significant impairment in health-related quality of life. And I think the problem is even worse when it comes to refractory ITP. The patient with refractory ITP have additional burdens that should be considered. Fatigue, for instance, is more pronounced in these patients. And of course, there are additional side effects from the second and even third line treatments, adding more anxiety, actually, about the long-term outcome of the disease. In young women, for instance, there is heavy menstrual bleeding, but also concerns related to family planning. So you can appreciate that the burden of the disease should be carefully assessed and considered in these patients. On the other hand, sometimes, treatment of low platelet counts and bleeding symptoms will have, of course, a positive influence on quality of life, but this remains to be established, actually, and the evidence is quite conflicting. But I believe most experts in the community consider that the major treatment goal for both patient and physicians is not only to increase the platelet count, but also try to improve the quality of life. So in order to discuss all of these issues, I have the great pleasure and honor to receive today Mr. Marcus Frew from the UK. And Marcus has kindly accepted to share with you his feelings, his daily life, and what he went through with this ITP condition since he was diagnosed at age 19. So Marcus, welcome, and thank you for accepting to share your experience with us and with the ICH audience. So my first question to you is just if you can introduce yourself, especially how you ended up being diagnosed with ITP.
Well, good afternoon, Professor Mohty, and it's really so nice that I can share these things, and if I can be of help to anybody, then that's really very good for me. My diagnosis was made a long time ago. You know, as age, I realized I'm 55 next year, so 1989 seems an awful long time ago now. But it was made in 1989, and at that stage, when I was 19, I played a lot of rugby, I played a lot of football, I went swimming, I played all the sports that one would do. And then one day I came back from playing a rugby game, and I had a little bit more bruising than I would normally have. You know, when you play rugby, you're going to get a bit of bruising as part of the normal sort of knockabout stuff that rugby is. And there was some petechiae, marks on the skin, and I felt really tired, but I just thought, look, I've had a big game of rugby. We actually won that game, which made me feel good. But these symptoms would, the bruising would normally just go away, and I would be fine. This particular occasion, the bruises were there, several weeks later, and I was feeling continually tired, and the skin problems were still there. So I thought, well, I better get it checked out. And in my head, it's probably nothing. I will be fine, but I thought I'd better get it checked out. And then when I saw the GP, they did a full blood count, and it was discovered then the platelet levels were low. And then this was repeated and done over a few months, and it was then diagnosed as ITP then, after several blood tests, and they suggested that then the treatment was splenectomy, or, well, first of all, sorry, I put on prednisolone for a while, which really increased the platelet count dramatically, very, very quickly. But clearly, being long-term steroids, long-term prednisolone is maybe not such a great idea. And then I stopped taking the prednisolone, and the platelets went reduced again. At this point, I was quite hurt because I couldn't play my rugby anymore, and this was a big thing for me. At 19, I was, and I just thought in my head, I thought I'm going to be treated with a few things, and I'll be back playing rugby very quickly, and everything will be fine. And I realised actually it wasn't. And when the hematologist that I saw suggested to me that I have this condition, I thought, I thought I'll be fine, I can cope, everything's going to be fine. Again, I'll be back playing sports. And then he said, well, actually, no. He said, if your platelet levels at the time were too low to be considered going back to competitive sports again. So I thought, okay. And then I had the splenectomy, and for a short while, the platelet count did go up. Yeah, it did. And it did go up, but not to the significant levels that I thought it would do. I thought, it went up to about 40 or 50, something like that, which although is better than it was, that level was not considered high enough to go back to playing competitive sports again. So
I guess, Marcus, sorry to interrupt.
No,
at age 19, getting all of these news, did you realize, because I guess, at age 19, we are healthy, we are fit, we're gonna conquer the world, I would say. And how did you react psychologically? Did you really realize that you're going to handle a long-term chronic disease, or
no,
it was just they're gonna treat me, medicine is strong, and
no, exactly what you said. I thought they'll treat me for a bit, and then my life will go back to being completely normal again. All this stuff I can deal with. It will be a short-term fix. I'll be fine. So yeah.
So you went through steroids, then second line splenectomy, and obviously we all know the severe side effects of high dose and long-term use of corticosteroids, which of course weight gain, edema. You need to be careful about eating salt, sugar, risk of hypertension, diabetes. So this makes your daily organization, I would say, very, very difficult.
Well, added to that, Professor, I noticed that, I know this sounds a little bit odd, but taking the prednisolone that I did made me really short-tempered and really quite aggressive, actually. And I just thought this is not normal, to get that worked up in such a short period of time. So I had all these other things, but my emotional thing about getting really, really angry very quickly was really worrying, and I just thought this is not like me. And so, and I could have put that down to the high dose prednisolone, the steroids I was taking. Yeah. Yeah.
Okay, so you had this diagnosed really at a very young age, and usually many of ITP patients are at young age, and
Yeah.
then you've been told that you cannot practice some of the things you love to do, like rugby, football, because of the risk of bleeding. But then you
Yeah.
mentioned actually that you went through splenectomy. So
Yeah.
in other words, your spleen, you underwent surgery under
Yeah.
general anesthesia, and they got rid of your spleen, let's say, because we believe that the spleen is involved in the retention of the platelets. And by getting rid of the spleen, then you have more platelets released, which in your case wasn't great. But then obviously, those patients who had a splenectomy usually would take prevention with antibiotics for life. So how did you handle this? Because like you started, let's say at age 20, someone telling you, oh, you have to take a pill every day for life. And I guess that's not what we usually expect.
No. And I think certainly for the first few years, and I hand on my heart, I admit it, I was not the most compliant of patients when it came to antibiotic use. Not because they were by themselves bad. It was only one tablet a day, but it was the fact I had to take these things, and it just, I thought I'm on these things for life, and then inevitably at 19, 20, you think I'm going to conquer the world. I don't need any medication. I don't need any antibiotics. I will be fine. I'm young enough. I'm fit enough. I don't need this. And I was told many times that this is important for you to do this. And I had several run-ins with my mum, as you would expect. Even though I was 20, she said, "You must take these antibiotics." And so I was sort of backed into surrender. Actually, I just said, "Look, I'm just going to have to do this." I didn't take them every day, but I didn't take them at all for the first few weeks, and because I was just being belligerent and probably a bit arrogant, and so, but I then thought this is actually important, and my hematologist said this is important for you to do. So I then took them every day and have been since.
So with time, you accepted this condition, but obviously, although we don't know exactly what is the level of the risk, but I guess in contrast to other people without ITP, you had to keep up very seriously with your regular vaccinations, especially flu, and I guess during the COVID pandemic, you were among those people at risk. So how did you handle this? Did you start to become extremely cautious, or you were still refusing to admit and go through all of these stringent measures, I would say?
No, it's a very interesting point. I think I sort of took a bit of a middle line, really. Yes, COVID. If I did, if I did get COVID, I knew I would be ill, seriously ill, potentially. So I took all the precautions that I was told to do. Wash your hands regularly. If you get ill, treat it quickly. Above all else, then don't wait till you feel really sick. If you get any hint of a chest infection, any hint of anything like that, get it treated quickly. But very, very fortunately, from as I live on my own, and both my children were at university, I didn't have anyone else in the household, which was for me actually very good, because I didn't subject my to infections from other people. But I took all the same precautions everyone else did. Wore the mask, regular hand washing. I had bottles of disinfectant gel everywhere in every room of the house. Everywhere I went to wash my hands. Every time I went out, I took a bottle with me, which wasn't very often, but I took one with me all the time, and I tried to cut down on any contact with other people, and wore a mask every time I had to go food shopping, so I wore the mask and the visor then. And so I was advised to take vitamin D, which I did do. So for the one time, I got some free vitamin D from the government in the UK. So I get nothing else free, but I get a load of vitamin D tablets. So
Fantastic,
that's
fantastic.
how I took them.
So, well, of course, there
Yeah.
are all of these precautions
Yeah.
and prevention measures. But then, what was the reaction of your family, your friends, if someone was telling you, "Oh, we're gonna go together to the mountain and I don't know, relatively risky physical activity"?
Yeah.
What was the impact? How did the people around you, your environment reacted? You say, "Oh, sorry guys, I can't do
Yeah.
this," or how was it?
They were generally fine, actually. When I said about, I'm not only with this COVID, but this is another layer of sort of level that I have to think about. They were okay, actually. They were fine. There wasn't any pressure put on me, and it was fine. Yeah, yeah, remarkably, because I thought I thought it wouldn't be quite like that, but I did say to them, look, if I get COVID, I could end up being in hospital, and that's a different story. So it was okay.
Excellent. Well, no, that's good. That's good news,
Mm.
which means I think overall you managed to cope with the chronic condition and adjust your lifestyle
Yeah.
to it. But I guess uh, there are always frustrations saying,
Mm.
why me? And
Yeah.
there are things I can do, I can't do. But there are things, it's not only about leisure and hobbies.
Mm.
Assuming, for instance, you need a surgery.
Yeah.
And then, the most easy, quick, benign surgery can become a big matter of concern
Yeah.
in someone who has a low platelet count.
Mm.
Did you have such experience or such episode?
Yeah, I did, and in fact, it's still ongoing, but it's slightly more manageable. I need to have surgery on a prolapse disc, several actually. I've got three in my back that I do need surgery for. But as always, the problem with this is that you could have your platelet count, and I did take and I had to have a platelet level of 100 for the surgery. That was the sort of the threshold. And I was never near it without taking anything at all. So I took some medication. First of all, I had the IVIG, but that failed. It didn't increase my platelet count at all. Then I took another product, and that was brilliant. It worked within about 4 weeks. My platelet went up to 110, 120. And this was unheard of. I've never ever had 110
You were
platelet
very
count before.
happy.
Yeah, I was delighted. I thought for once I found something that worked it's not prednisolone, and I thought fantastic. But clearly then to line that up with to go into surgery and to have the surgery space, it's just been completely impossible. Yeah.
So that's one of the most
Yeah.
difficult issues.
Mm.
So beside the medical management, did you notice that the healthcare professionals you're dealing with,
Yeah.
whether you're a GP,
Hmm.
whoever, a hematologist, surgeon, uh, uh, do you think we're taking enough into account the quality of life and the psychological impact for this? And another word, I
Mm.
guess you were extremely frustrated because you're not able to undergo the surgery
No.
routine as usual.
Mm.
Did you believe that that was frustrating? But what was, the healthcare professional was saying, oh, this is how it is, and we can't do anything about it.
Um,
How did you cope with it?
well, half and half was true. That the hematologist had said, yes, we can do everything about it. We can get your platelet count, and they proved they could get the platelet count to above levels. But it was the surgeons who they said, we can't, that's short term. You have to have it within a very short term. Your platelet count goes to above 100. You need to have it done virtually within a couple of days. That was just simply going to be impossible. The other point, they said you could have it done, as you know, in the UK, we have our healthcare system that's essentially free, but you could have a private care as well. And they said we could do it privately. The only issue to that was if I was bleeding at 3 o'clock in the morning, the support for a hematologist wouldn't be there. There would be no hematologist on call in a private hospital. And I just thought, this is just not, I'm not taking that risk. So, but I've managed the back pain. I've managed it, reasonably well. I do exercises. I see an osteopath actually, and they every 3 weeks, and they usually keep it going. So I've not needed the surgery. 2 years ago, I really needed it, and I was really, really frustrated. I wasn't getting it. I was in a lot of pain, and I just thought, this is never going to happen, but I need it. But actually, as the time going on, I've managed to control it a bit better. So I don't think the surgery will ever happen, but on the other hand, I'm managing that issue very well now.
Well, fantastic. It's great to hear, but sorry that, of course, you had to go see these hurdles. And, the health systems, I mean, whether in the
Yeah,
UK or elsewhere, are always complicated in general to navigate. And of course, when it comes to so-called risky procedure,
yeah,
obviously, the reaction of the healthcare professional is going to be slightly
yeah,
different. So I think when we discussed this broadcast, also you mentioned the issue of infections
yeah,
and where you had to be hospitalized.
yeah,
Again, you are young, fit, and sometimes it's very difficult to explain, to our environment, and especially everybody would consider this is a benign, thing,
yeah,
just
yeah,
having your platelets, which are low, but at the end of the day, it can brings a lot of trouble.
yeah. Yeah, particularly with the splenectomy, you are susceptible to more infections, clearly, without that. And again, going back to this thing, I'd have a chest infection, and my attitude was, I can conquer everything. I will be fine. I will, I won't need this. And I should have gone to the treatment quicker. Absolutely. I was given oral antibiotics, but these just didn't work. And then I was going downhill, and then I in fact, it was a bit of a shock. I got taken to hospital by ambulance actually, because I was in the state that I just couldn't. The pneumococcal, it was, had gone so far into the lungs. I was having problem breathing, and it was, yeah. So I phoned the immunologist who I was under at the time, and he just said, ambulance, blue light, to hospital. So that was a shock. I'm going into hospital for IV antibiotics, and it was pneumonia. And I was fortunate that I did go when I did. But I thought I couldn't have done anything more. I was taking the prophylactic antibiotics anyway. I was doing all these things, and still I got quite a severe infection. In hospital on IV antibiotics for a week, and then came out. And that taught me a very valuable lesson, actually, to get it treated quickly. Don't think you're alpha male and you can cope with everything. Early infection, early treatment, and I've kept that up. If I get an infection now, I get it treated quickly, and everything is completely fine. Everything is normal. I have the oral antibiotics for 2 weeks, but they get it treated quickly, and usually steroids as well. I get prednisolone as well, maybe for a chest infection. But when I get those done, it is fine. So I would urge, anybody, early treatment, and it certainly saves you a huge amount, or can save you a huge amount of problems later on. And
Oh, thank you, Marcus. This is really a very lovely,
mm,
positive, I
yeah, yeah,
would say, thought, which is important because now you have more than 35 years
yeah,
experience, I would say,
yeah,
living with ITP and all the burden of this chronic condition, both from a psychological impact,
yeah,
lifestyle, but also medically speaking. So, and I believe what you are facing with ITP
mm,
would be similar to any other so-called chronic condition in
yeah,
general,
yeah,
with the addition that in the case of ITP, there is this risk of bleeding, which can be serious, especially if it is an
yeah,
internal bleeding. And this is why
mm,
patients are given long, long list of recommendations and advice, things to do, not to do.
yeah.
So uh, today, after 35 years,
Mhm.
and what would be your advice to anybody living with an ITP and any other chronic condition?
Certainly, well, for me, if I'm going back to the sports, just find something. If you can't play contact sports, find something else to do. Actually, you doesn't have to be contact sports. You can. I did a lot of interval training, kept fit that way. Um, and going back to this, if you get an infection, treat it early and quickly. I wear a little medical alert bracelet there with everything on it. Should there be a problem? The vaccinations, clearly, absolutely keep up with them. Keep up the vaccinations as including the COVID booster. Got that. Um, but be alert to infections. But I think it's quite easy, and certainly after I was in hospital, to think, you know, to get quite paranoid about things. You do a little cough and you think, oh, I have another chest infection. I'm going to go to hospital, and it doesn't have to be like that at all. Just be aware of what's happening to you, early treatment, and listen to what the hematologists and your team tell you. If they say to have your vaccinations, get them done. Not to take, not to put yourself in any great danger and any greater risk, and but enjoy what you're doing, and just try and draw a line between feeling that everything's going to happen to you and that nothing's going to happen to you, and that you can manage these things. And it's not it's and listen to what you're told, and do what you're told. Actually, I think is the reason. If the GP says we need to do these vaccinations, get them done.
Superb, superb. I think these messages and the advice you're giving to our audience and
Mm,
to anybody confronted with a chronic condition is extremely important. I like the idea is we can always find an alternative.
yeah,
Life cannot be exclusively linked to this or this. There is a wide variety of alternative.
yeah,
Of course, we need to accept the idea of listening, I would say, although sometimes we're unhappy and we dislike some of the recommendations. But again, I think my understanding, your message is that it never prevented you
no,
from living the life you wanted to live.
no. I guess the only thing I could say is I always wanted to be an international rugby player, but I, and my ITP stopped me. But also the fact I wasn't actually good enough probably had something to do with it as well. So, but I can always say to people, well, I could have been an international rugby player, but my ITP stopped me. That was the only reason. Everything else was fine. So, but I wasn't maybe as good as I thought I was going to be. So
Thank you very much, Marcus. It was a true delight to discuss with you, to listen to your story. I think you're doing extremely well. And here at the ICH, we were extremely proud having you with us. I'm extremely grateful, and on behalf of the whole steering committee and scientific committee of the ICH, I'd like to thank you so much for accepting our invitation to share your experience, your thoughts, your feelings. I
No,
hope you will
I'm really,
continue to
really
do well,
delighted and
and
delighted.
please stay safe and keep well. See
Okay.
you soon. Take
Thank
care.
you. Thank you.
Bye-bye.
Bye
Bye.
bye.